HIV most often spreads through having unprotected sex with an infected person. It may also spread by sharing drug needles or through contact of the blood of an infected person. The first signs of HIV infection may be swollen glands and flu-like symptoms. These may come and go for a month or two or even years after the infection. Severe symptoms may not appear until even years and months later. HIV infects the cells of the immune system. In particular, HIV attacks and destroys the T cells, which are crucial to the immune system and the immune response.
Treatments for HIV. An HIV infection is typically divided into 4 stages: acute primary infection, clinical latent infection, symptomatic HIV infection, and progression from HIV to AIDS. Acute primary infection is within the first few weeks of contracting HIV. 70% of people will experience flu-like symptoms. Fever, headache, upset stomach, and muscle soreness are amongst the most common initial signs of an HIV infection. A positive diagnosis is possible at this stage, but many will not associate their symptoms with an HIV infection, unaware they have contracted the virus. During the acute primary infection, HIV-infected cells are circulating through the blood system. Your body responds by producing HIV antibodies and cytotoxic lymphocytes. These are killer T cells that seek out and destroy invading viruses or bacteria. 2 to 4 weeks after infection, the immune system mounts an attack against the HIV with these antibodies and killer T cells. This will result in HIV levels in the blood will be greatly reduced and CD4 T cells count rebounds slightly. For those of you who are not aware what CD4 blood cells are, they are helper cells that are white blood cells that are an essential part of human immune system.
Clinical latent infection. The second stage of an HIV infection has an average duration of 10 years. During this phase, people infected with HIV live almost normal, asymptomatic lives because the infection has likely not caused any additional symptoms or conditions. The circulating
symptomatic HIV infection. Over time, HIV destroys your immune system. Once a person's viral load, which is a measurement of how many cells in your blood are infected with HIV, begins rising to higher and higher levels, this is an indication that the immune system is deteriorating. The disease is reaching a more advanced stage. If they are not ready, many patients will begin treatment with antiretroviral medications at this point.
Symptoms such as flu-like feeling may occur. Rash and on the arms or legs, sore throat, bad headaches, nausea and vomiting, fever, chills and night sweats, rapid weight loss, blurred or disordered vision may occur.
HIV is tricky, and some people will create no symptoms of infection until the damage of their immune system has progressed. So, when in doubt, get tested. If you notice any of these symptoms presented here, ask your doctor for an HIV test. It is as simple as a blood test, and if you live within the United States, you can order a home HIV test kit online using the FDA approved or a quick in-home HIV test, which doesn't require you to send the sample to a laboratory. It simply test yourself and see the results within 20 to 40 minutes.
We explain HIV and AIDS. The human immune system defends the body against illnesses all the time. It uses guards in the blood called T cells to recognize any intruders and destroy them. But instead of attacking the body, the human immunodeficiency virus, or HIV, attacks those T cells themselves. It turns them into copy machines to make more copies of itself, then eventually kills the infected T cells. Without treatment, it takes 8 years on average for a person with HIV to develop AIDS, or acquired immunodeficiency syndrome. By then, there aren't enough T cells to fight off various infections and diseases. So it's not the virus directly, but the diseases that are eventually fatal. Humans first acquired HIV from blood contact with apes, and gradually transmitted it to more people through unprotected sex, used syringes, and childbirth. AIDS remained undiscovered until a sudden outbreak among gay men in New York and San Francisco in 1981. Very quickly, people began developing the same unusual symptoms around the world. The patients suffered from rare forms of skin cancer, pneumonia, or thrush, and few survived. Prejudice against homosexuality made research funding hard to get, and more people were getting sick. What could be done? Keep the virus from spreading. It became clear that the best preventive measure was safe sex, as condoms kept the virus from infecting others. Additionally, blood banks started testing blood, and new programs even distributed clean needles to drug users. Finally, in 1987, the first treatment against the virus was released, the ancestor of combination therapy. The medication still isn't a cure, but it keeps the virus from multiplying and destroying the host's immune system. By starting treatment early, people with HIV can now live long, healthy lives. Unfortunately, many people still lack access to medication, especially in sub-Saharan Africa. Over the last 30 years, about 36 million people have died, while 2 million more are infected each year. Scientists have made a lot of progress, but are still looking for the cure. You too can help end the AIDS crisis. Play safe, get tested, donate to support research, prevention, and care, and spread the word.